हाय गाइस, वेलकम टू आरोग्या फिजियोटिप्स। आपका आरोग्या फिजियोटिप्स में बहुत बहुत स्वागत है। टुडे व्हाट वी आर गोइंग टू टॉक अबाउट इज इलियोटिबियल बैंड सिंड्रोम, ओके, और आईटी बैंड सिंड्रोम commonly happens to runners or people who are involved in lot of physical activity. What exactly happens is you will have pain from starting from your hip bone, so starting from the femur, it goes all the way down to the lateral aspect of the knee. So basically you can just feel pain either throughout the lateral aspect of the thigh, or you can feel pain starting from anywhere in the mid of the thigh till the lateral aspect of the knee, or just the lateral aspect of the knee. So what happens is it's basically a repetitive activity which causes this, especially if you have adductor muscle weakness. Now what are adductor muscles? Are the muscles which basically take your hip away, okay? So if my leg is going away, is the muscles which are involved are the hip abductor muscles. So hip abductor muscles are weak, it can cause IT band syndrome. Second is repetitive activity. So you're doing lot of running, but you're not strengthening the hip muscles or knee muscles, and this can also cause lot of pain in your lateral aspect of the knee. Good point is that you can do certain activities which can reduce this pain. One is basically you should try doing foam roller as weekly once procedure, especially if you are involved in a regular physical activity. Weekly once you should keep it for foam roller. We already have a foam roller video shot, and that especially we have one for IT band, so you can go through that. We will link the description in the description box. Now what exactly is IT band? IT band is a thick fascia, okay, very thick fascia, and what happens is when you go to a physiotherapist or when you actually palpate yourself in the lateral aspect of the thigh, you will feel that there are lot of nodules formed on the lateral aspect, or it's not a very smooth place, it is a very irregular place. So first is try palpating with that pain what you are having at that, try palpating that place. If it is very irregular or you are finding lot of nodules, there are lot of chances you already have a IT band syndrome, and you should visit your physiotherapist to get out of it. The second thing which will actually cause is the thing is you are involved in some sports, okay, and you have a regular training schedule where you are missing your exercises and you are just paying attention to the sport. So then it can happen in those cases, and if it is a long standing case, you may have to do a activity modification. For example, if you are running, then you may have to go for swimming, and this can happen for 1 week to a month time or 2 months, okay? So don't try to first exaggerate it, because it is caused because of repetitive activity, so you can't do that same activity again. So instead of running, you can go for swimming, okay? Try to give it a rest. Apply cryo or cold pack thrice, maybe in a day, thrice, okay, 10 minutes, and then even then also it doesn't decrease with not doing the activity, giving itself rest and cryo, then you should definitely visit a physiotherapist. Today we will demonstrate some of the exercises which you can do with IT band syndrome. So the first exercise, which is everybody's favorite, is bridging. So let's start with bridging. Legs together. Anybody who has been following us already knows bridging. So you can take, I'm using the weight, you can use the loop band, resistance band, whatever. You can hold it there for some time and relax, okay? So try bringing it closer and taking it as much up as possible. You can even do some bridging variation in which actually you take the leg slightly away and come on your heel, and so that it basically emphasizes on this area. So you can do this maybe 10 to 20 repetitions, and you can actually do 2 or 3 sets, because bridging is really good. The next exercise, which is very good for IT band, is figure of 4 stretch, because it stretch laterally. Again, we have done this exercise in sciatica. This is very good for IT band as well. So you basically stretch your leg and hold it here for 20 to 30 seconds and hold the stretch. So repetition here is not important. You can do 5 to 10 repetition, but holding it for as long time is more important. The next which we can do is taking the, stretching the leg to the side is basically taking the leg all the way down, the other leg, okay, taking it towards the, so that this stretches, okay, taking it to the other side and holding it as down as possible, and again holding it for 20 to 30 seconds and 5 to 10 repetition on either side is possible. Don't do it for one leg, try to do it for both the legs when you are doing it. Next exercise is clamshell, which you can do even with the loop band later on. So nothing, you have to just bend the knee and try to take it up and bring it down, okay. So basically take it up and bring it down. Breathe in and breathe out. Breathe in and breathe out. Okay, so clamshell is again very good. Again, you can repeat it for say 20 times, and you can do 1 to 3 sets. As I said, you can use the loop band. For example, instead of loop band, if I'm using the weight, I can actually keep the weight here and do the same workout. Okay. Another thing I had told that it is because of hip abductor weakness, so you strengthen the hip abductor muscle. So you basically try to go up, make sure your pelvis is not bent forward, it's not rotated, so it's in neutral, okay, and you just go 45-degree angle, toes pointing towards yourself. Hold this position for 10 seconds and bring it down, and again take it up, hold it for 10 seconds and bring it down. Again you will do around 10 to 20 repetitions, okay. So you in sideline position you can actually do clamshell and the side leg raise. So in this position, basically lie down prone, lie down on your tummy, both the hands out, and you can take the affected leg and point the toes down and hold this stretch for some time, say 20 seconds, and bring it back and then do it on the other side. So this is called scorpion stretch, and it's very good for IT band. Apart from these, hip flexor stretches are also very good, and we have already done a video on hip flexor. We will link it in the description box. Please go through that. Next you can do donkey kicks. So you can actually kick and try to take it as up as possible, toes pointing towards above, and come back and then kick again and come back. Try not to arch your spine. So when you kick, try your spine to be as much neutral as possible and bring it back. Again, you can do around 10 to 20 repetitions of this. The next exercise which you can do for IT band is also taking it to the crisscross. So basically I tell the patient to cross it this side and then do it this side. So basically you can even hold it for 10 to 20 seconds. If you are holding it, then you can lessen the repetition. So another exercise which you can do is hip hike. Make sure you have a stepper there. You can keep one leg here and go all the way down and bring it up. Go all the way down and hike your hip. Go down and bring it up. So next we can do piston squat, in which we basically squat on one leg. So bring one leg down, the other leg up, and you try to go as much down as possible and come up. Okay, try to go as much down as possible and come up. Okay, and relax. So next exercise you can do is single leg windmill. So you basically takes one leg slightly front and come as much down as possible. When you are comfortable here, go all the way down
and don't support here. Okay, so you're basically touching and just, you're basically using it for slight support, and slowly come back. Similarly, you will go with the other leg. Now all these exercises, you will notice I'm not telling you how many repetition you should do, because they are slightly harder, so do it as much as possible for you. So next what we can do is wall squat with single leg. So you can basically go slightly front, go all against the wall so your back is flat, and then you try to go as much down as possible with one leg and hold it there for as many seconds as possible and slowly come up. Similarly, you can do it for the other leg. Now hold time and repetition. Everything depends on you. Okay, so the exercises which we have demonstrated today are very, very good for IT band syndrome. Try to do those exercises, and I have told you to do hip flexor exercises as well, which we have already done, and like exercises like Thomas exercise, which we have already demonstrated before. So I will link it in the description box. So do these exercises and start your activity. Don't stop doing it. So first you rehabilitate yourself. If the pain does not decrease, then make sure you go to a physiotherapist who may do lot of myofascial release. They do something called chiastium. We do shock wave. So a lot of other things can be used to reduce your pain. So you can visit your physiotherapist. So do these exercises and tell us whether you liked it or not. Keep your feedback coming. That's very, very important for us. And always remember to exercise every single day and witness your fitness with us.